Here's something that might surprise you. Residents living within 50 meters of cell phone towers reported more health symptoms across every single category researchers studied. Mood and energy problems, cognitive issues, inflammatory conditions, and anatomical complaints. This finding comes from a comprehensive study conducted in India, where researchers took an approach that sets this research apart. Instead of simply estimating exposure based on distance, they actually measured radio frequency electromagnetic field levels inside people's homes. The research team surveyed 309 residents living at various distances from mobile phone base stations. They measured RF-EMF power density in each home and asked residents about health symptoms across 4 distinct categories. What they found challenges our current understanding of safe exposure levels. Residents exposed to power densities between 5 and 8 milliwatts per square meter in their homes reported significantly more symptoms than those with lower exposures. Here's the critical point. These power density levels are well within current regulatory safety limits. The symptoms weren't limited to one area of health. Residents near towers reported more mood and energy problems like fatigue and irritability. They experienced more cognitive issues, including difficulty concentrating and memory problems. Inflammatory symptoms like headaches and allergies increased. Even anatomical complaints such as joint pain were more common. Perhaps most intriguingly, the study revealed an unexpected age pattern. Residents under 40 years old living near base stations actually reported more inflammation-related symptoms than older residents. This challenges common assumptions about age and electromagnetic field sensitivity. The researchers found that RF-EMF exposure strength in the home was the strongest predictor of symptom prevalence, stronger than age, gender, or other demographic factors. This study adds to a growing body of evidence suggesting that our current safety standards may not adequately protect public health. As I explore in my book Empowered, the sheer volume of research linking EMF exposure to biological effects across diverse systems makes these real-world health associations increasingly concerning. What makes this research particularly significant is its methodology. By measuring actual exposure levels rather than estimating them, the researchers provided concrete data about the relationship between RF-EMF intensity and health symptoms. So what does this mean for you? If you live near cell phone towers, you're not powerless. First, you can measure the actual RF-EMF levels in your home using an RF meter to understand your exposure. Second, consider EMF shielding solutions for your bedroom and main living areas to reduce your daily exposure. Third, advocate for stronger safety standards in your community. Current limits clearly don't account for the health impacts documented in studies like this one. The evidence continues to mount that proximity to wireless infrastructure affects human health in measurable ways. The question isn't whether these effects exist, it's what we're going to do about them. Find the full study and hundreds more at shieldyourbody.com/research. Find the full study and hundreds more at shieldyourbody.com/research